High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Blood pressure is determined by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher blood pressure. High blood pressure generally develops over many years and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to control it. There are two different types of high blood pressures. Primary, which is also known as essential hypertension, and secondary hypertension. For primary, there is no main cause for high blood pressure. This type of blood pressure usually develops over many years. For secondary, there's usually an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medication can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, and illegal drugs. On to complications. There are many complications that come with the high blood pressure. Heart attack or stroke, aneurysms, heart failure, weakened and narrow blood vessels in your kidneys, thickened or narrowed torn blood vessels in your eyes, metabolic syndrome, trouble with memory understanding, and dementia. On to risk factors. There are many risk factors dealing with high blood pressure. Some of them include age, race, family history, not being physically active or using tobacco, or maybe even drinking too much alcohol or stress even, along with too much sodium in your diet or too little potassium.
Symptoms. Most people with high blood pressure do not have symptoms, but when they do, the signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. These symptoms include headaches, shortness of breath, and/or nosebleeds.
This one lists fast facts to educate people about hypertension. Did you know 1 in 3 people have it? It is also known as the silent killer. It also contributes to nearly 1,000 deaths a day. It is also more common in African Americans.
This graphic shows from 2001 to 2009, the South has a higher prevalence of blood pressure. Doctors can use this information to target a population on how to reduce risk factors that can lead to hypertension.